We're
Okay.
live.
Yeah, okay, yeah, saw the signal there. Perfect, thank you. All right, good evening, everyone. I will call the February 18th, 2026 meeting of Lakelands Public Health to order. We are virtual today, and so given the weather, appreciate everybody moving to the virtual method for this afternoon's meeting. I will provide a land acknowledgement. There we go. Okay, we respectfully acknowledge that we are on the traditional lands covered by Williams Treaties. This territory is part of the traditional lands of the Mississauga and Anishinaabe peoples, whose presence here continues to this day. We recognize the enduring connection of Indigenous peoples to this land, the waters of the Otonabee River, and the broader territory of the Great Lakes region. We acknowledge the impacts of colonialization and the responsibilities we share in honoring treaties, supporting Indigenous sovereignty, and building respectful relationships. We offer gratitude to the Indigenous communities who have cared for this land for generations and commit ourselves to continuing learning, reflection, and meaningful action toward reconciliation. Put that aside. Okay, we have a agenda that was circulated prior to the meeting. Any amendments to the agenda? Seeing none, get a motion to approve the agenda as circulated. I see some hands. I see Dr. Ramesh and Dr. Stelzer. All those in favor? See some hands. Thank you. And adoption of the regular minutes. The minutes from the previous meetings of January 21st and special meeting of February 2nd were circulated. Are there any amendments, corrections? Seeing none, motion to approve. And we have Mr. Maloney and Warden Clark. Any further comments? All in favor? See some hands. Thank you. And that's carried. Is there any business arising from the minutes? I don't have any. If anybody has any. Don't seeing any, we will move to item 6, Medical Officer of Health report, and Dr. Piggott to take that one.
Yeah, good evening, Board Chair and Board of Health. Thanks for being here in February, and hope you stay warm through the snow. Just a few small updates and items from my perspective here today. The first to share with the board is we're excited that with the new branded Lakelands logo and materials, the exterior signage is being put up at the different office sites. And so you'll see that up. Some of them have it up already, and some of them it'll be up momentarily. So that's exciting. And I wanted to acknowledge on the new signage, the Anishinaabeg name translation that was supported through the Indigenous Health Advisory Circle, and together with a language holder, an Anishinaabeg language holder from Curve Lake, who supported that translation. So that is, I think, a really important part of the new signage and name and logo. We will share more about the meaning of the translation and how it came about with the board at a future meeting. For now, there's going to be some initial presentation in honoring of that new name at the Indigenous Health Advisory Circle meeting this coming Friday. So I wanted to share that. The second item is we've in previous Board of Health meetings discussed some Board of Health educational opportunities. And with the group that the province has worked with to get some standardized support for all 4 merged health units, we're in the process of scheduling those educational opportunities and sessions. The vice chair, chair and myself met with the group who is affiliated with University of Toronto and had some discussions around perhaps education opportunities and needs for this particular board based on the conversation we had at the last retreat. So those will be coming forward with a schedule for the year and the timing. We're thinking based on the feedback from the board of a sort of coffee time, 8 or 8:30 a.m. early session for 30 to 45 minutes, or adjacent to a board meeting if possible as well. So details of that will be forthcoming. And my third and last announcement, the most important, a significant one, is that last week, unfortunately, I received notice of resignation of Dr. Natalie Bocking, our Deputy Medical Officer of Health. And so I wanted to acknowledge that here to the board today. Dr. Bocking is here with us. And from me and my perspective, just a tremendous thank you extended to Dr. Bocking for all of the work that we've done together over the last couple of years of the merger journey. And before, collaborating as neighboring health units and as peers, and now here within Lakelands. Been deeply fortunate and grateful to work alongside Dr. Bocking through this really challenging journey for the organization, and deep and immense respect for Dr. Bocking, her work that she's done here, and really from my perspective, wishing her the very best in her future endeavors. So Natalie, I think you're here and on, and maybe I can turn it over to you if you want to share a few words with the Board of Health or community.
Sure. Thanks, Dr. Piggott. And good afternoon, everybody. Thanks for giving me the opportunity to say a few short words. My time at HKPR and now Lakelands Public Health has granted me many amazing opportunities to work alongside passionate and committed staff and community partners. I'd like to take a minute just to say thank you to all of the staff at Lakelands Public Health. You are an incredibly talented group of people, and I've learned immensely from you. I have full confidence that you will continue to put the public health needs of the communities that we serve first and foremost. I also wanted to take the opportunity to say thank you to our many community partners that I worked very closely with over the last several years to improve the health and well-being of our communities. It has been a true pleasure. And finally, I look forward to hearing about the many great things to come at Lakelands Public Health, and wish everybody all the best. Thank you.
Thank you, Dr. Bocking, for that. And certainly on behalf of the board, I want to thank you for the time you've spent through the merger. We all knew mergers were very challenging times, and having your voice at the table to bring things together and bring resolution and understanding and all of those things that we needed through the merger, the decision to make the merger, and then over the past year or so with the new Lakelands organization. It's been challenging, and the board greatly appreciates every effort that you put into making it the success it is today, we believe. And on behalf of the board, I want to wish you all the best in your future endeavors. I'm sure we'll see you around, and look forward to doing some things with you down the road, maybe when that opportunity might arise. So. Again, thank you from the board. I open it to any of the board members who want to say a few words. Deputy Mayor Richardson, I see your hand up, and yeah.
Thank you very much, and through you, Chair, I want to take this opportunity to thank Dr. Bocking as well. I've been working with her since April 2021. I can't express how deeply grateful we were for your unwavering support throughout the pandemic and for the steady and passionate leadership that you brought to the public health during this most challenging time. And you became the voice for our community, and you made an incredible contribution, and you really did impact our communities. I sincerely just want to thank you for your steadfast work through the merger. And I know that your next chapter will be fantastic just because you were fantastic. So thank you again for having this opportunity to work with you the last few years.
Oh. I've got a shared screen here from Councillor Real, I think. Is everybody else seeing the same thing? Oh, there we go. All right, and I think I saw John's hand up, did I? Sorry. John or Dan? Dan, maybe you want to go first?
Oh, okay.
Yep.
Okay, thank you. And through you, Chair, to Dr. Bocking, I also want to thank you. Didn't get to know you as well as Councillor Richardson because I got onto the board. I think I had one meeting before the merger, so it was a very fast introduction. But everybody I talked to has said phenomenal things about your work, and so just wanted to say thank you as well.
Great, thanks, Councillor Joyce. Councillor Royale, and then Mayor Logal, are you?
Yes.
Okay. Yeah. So Mayor Logal first,
Mhm.
and then Councillor Real.
Well, Dr. Bocking, I just want to thank you for all of the efforts that you've had with the former HKPR and your move to the Peterborough or the Lakelands Public Health has been astronomical. I admire you for your professionalism, but I really admire you for the person that you are, and I hope we can work or see each other together again. Thank you so much.
Thank you, Mayor. And Councillor Real.
Yeah, the big thing I wanted to say, and I'm going to call you Natalie as opposed to Dr. Bocking. That's not disrespectful. It's just, I think it's a relationship that we built while we were at HKPR. And I want to also tell you that that hockey tournament that we had in Napanee, I actually showed up. I don't know if you can see it, but I was there. That's a picture of my wife in the middle of the thing. And I apologize for not being able to get it to you, but that was a big, big tournament. So hope you had a great time. Don't know if your kids won or not, but if they didn't, I'm sure they had a good time. Thank you for everything you've done for us.
Thank you, Councillor. Anybody else? Councillor Real.
Natalie, I didn't know you well until we had the merger, but I was so looking forward to working with you. All I can say is, thank you very much for all the work that you put into the amalgamation, but also I wish you all the best in your endeavors as you move forward with whatever you're going to do with your career and your life. But again, kind of heavy-hearted that we won't get to work together. I was really looking forward to working with you.
Councillor Real. Anybody else? Oh, there, Councillor Chica.
Thank you. Through you, Chair Black. Dr. Bocking, Natalie, I just wanted to say thank you so much for the spirit and expertise that you brought to, well, to the beginning of this Lakelands Public Health. We've only known each other in that time and through our work towards the merger. Just so insightful, and I so appreciate your professionalism and your caring for people and for community. That just so resonated to me. So I thank you very much, and it's been nice getting to know you in your professional role, and your leadership has been phenomenal. So thank you so much.
Thanks, Councillor. And Warden Clark, I see your hand up.
Yes, thank you. And through the chair, Natalie, bringing two boards together is never an easy time, and your guidance and Thomas's through this, I just want to thank you for that and wish you all the best for the future. I know you will do well, and you're needed. The healthcare professions, certainly we need those. So please continue your service. Thank you.
All right. I think that's it, unless I don't see something here. Everybody's very small on my screen with so many people. All right. So again, on behalf of the board, Dr. Bocking, again, we appreciate everything you've done for us, and look forward to seeing you in the future and working together someday again, for sure. All right. Thank you. I need a motion to receive Dr. Pigot's update for information only. Then we get a motion, Dr. Ramesh and Councillor Rial. All those in favor? Thank you. Item 7 is merger budget report approval, actually year 3. So Dr. Pigot, I'll turn that over to you.
Thank you, through you, Chair. As the board will recall, the provincial government is part of the Strengthening Public Health program, and the voluntary merger program had articulated that they would support mergers with funding based on a business case that was submitted in April of 2024 for 3 years, for a 3-year period. The third year of that, well, we just received formal approval for the second year of the budget. The third year of that begins April 1st, 2026, ends March 31st, 2027. So that will be the third, and as we currently understand, final year of merger funding. So in order to develop the budget, we had used the original business case plan and requests. We've updated accordingly in recent time with the truly forecasted budget needs for continued merger work. And to kind of just give us a high level overview and run through, I will turn it over to Larry.
Thank you. And to follow up on what Thomas has said, the year 3 budget is the fiscal year. So just a reminder that we did start this funding in April of 2024, and the year 3 ends in March of 2027. So this is for the 26-27 and year 3 budget for the merger. And as Thomas said, the starting point for this was the business case that was submitted and approved by the board back in February of 2024. And we did look at what needed to be removed because we had determined that those activities were no longer needed or that funding support wasn't needed, where we needed to add items and where we had more true costs for things. So the 11,263,000 is fairly closely in line with what was submitted as part of the year 3 budget. So in principle, it has been supported already by the ministry, but we have made sure that it is more relevant to what we actually need the money for. A couple of things I do want to flag. These are the document that you're seeing is the actual submission document that we sent to the ministry. It's their budget categories. They split the staffing between what's called transition and stabilization. And then within those categories, they split them again between program and administrative staff. But just to be clear, the transition staff are staff that are needed for the implementation of the merger itself, or for the backfill of positions, if positions that we have are working on the merger, those backfill positions. Stabilization staff are staff that are supporting the ongoing core work of public health, filling positions that have not been funded by the base budget for public health or the cost shared budget. So those are the ones that we will keep in mind and have kept in mind as we look at post merger costs and budgeting, because those over $2 million of costs will come forward as part of our base budget needs to be able to meet our core programs. So I did want to flag that one. I'll also point out that there are no capital requests included in this particular year 3 budget, whereas we did have capital requests in year 2 and year 1. So those budgets for capital paid for things where we needed to do renovations or upgrade our equipment, and that is being done through primarily the year 2, and we're not anticipating any future needs. Any of the actual larger capital projects would be funded through the capital branch. So that would be a separate application, a separate source of funding. So it's not that we don't have capital initiatives that we're continuing to work on, but it won't be as part of this budget submission. So I just wanted to flag that. That's all I wanted to share today, and happy to answer questions if there are any.
Thanks, Larry. Open the floor for questions. I see Councillor Royale first.
Larry, just a quick question. In relation to what we've been able to accomplish, including what we're going to get over the next year, do you feel that we have got what we were looking for out of the merger, or is there stuff that we maybe should have had and didn't get?
Through you, Chair, I will say that we have been fortunate to have the funding at the level we have had for this merger, but the shortfall is really in the timing. I think a 3-year process would still be a challenge for a complete merger and to cover all the costs and the processes that are needed for a successful merger. And as everybody here knows, we didn't receive approval for year 1 funding until 9 months into the first year. So the downfall, I think, of what we have had or not had is funding for long enough to complete all the tasks that we would like to complete. And at times it's felt like we have rushed certain initiatives because of the funding limitation. And that puts more pressure on change management and on particular staff to get things done on top of their regular job. So I do think it's not a problem with the funding amount. It's more about the funding timing. I don't know if Thomas has more to add to that.
Dr. Piggott?
Through you, Chair, nothing much to add to you, what you've said, Larry. I think that was great, just to affirm that the overall amount and budget and support been tremendously generous, especially when you compare to previous health unit mergers through the merger period. And so deeply grateful to the provincial government for that support. It's really helped to ensure that we've done this in a way that will augment and strengthen the services we deliver for our communities. But yeah, at a timeline level, it has sometimes been a challenge. So we've been in discussion, communicating that feedback to the province, and hoping, because this is an ongoing partnership with the provincial government in supporting these voluntary mergers, that there'll be consideration to longer term financial considerations and needs as the kind of work of the merger doesn't formally conclude at the end of March 31st, 2027. It will be an ongoing project, as I'm sure anyone who's been involved in municipal amalgamations could affirm as well.
Thanks, Dr. Piggott. Yeah, I mean,
Thank you.
we continue to advocate, as Dr. Piggott has said, with the province to consider those items that we weren't able to complete or not going to be able to get complete coverage on in the 3 years to hopefully extend those items into year 4 and possibly even year 5. So the advocacy efforts continue. And again, we are grateful for the support of the 3 MPPs that are in our area and their support at the provincial level. Again, wanting to make this a very successful merger, and I believe they do. And so we continue to work closely with them on the challenges that go beyond year 3, and believe that we'll get some support from them through this process, or continuing to get support through this process. I see Deputy Mayor Richardson's hand up next, I think.
Thank you, and through you, Chair Black. Just curiosity sakes, does this 3-year budget align with the original business case that we started with?
Larry, can you take that one?
Yes, it does. I mean, in terms of the first year budget, it was actually approved as submitted. The second year budget was certainly within like less than a few $100,000 from what we had initially submitted, and this year would be about the same.
Yeah. So we have used the majority of the funds that we've been given. There's both years we didn't use all of them, but as Larry was saying, it's been really challenging for staff to manage our day-to-day operations, as well as implement a lot of these changes that we propose through those merger budgets to bring the public health unit up to standards and improving on a lot of different areas that needed a lot of help. So I think for the most part, we've used the funds that we've been given. Warden Clark?
Yes, thank you. And through you, Chair Black, I think what really has been challenging, and the staff has been amazing, trying to put this together, is the fact that we were shocked when we were told that the gun had already gone off on the start time. And I think many of us at the table thought that it would be once we had signed the agreement and going forward. Instead, it was pre that. And so consequently, it seems as if we're always running to catch up. And I have voiced my opinion on that to all 3 of our MPPs, and just feel that it should have been about I want to say about 8 months after the fact of when they called the start, that it would have been certainly far better for us than having to react.
Yeah, Thanks, Warren Clark. No, I absolutely agree. We were in a very reactive mode for a long time. I think we're in a proactive mode now, but it took a year and a half to catch up for sure. Anybody else? Don't see any other hands coming up. All right, thanks for that. Can I get a motion to receive the report for information and approve the year 3 merger budget in the amount of $11,263,111 for submission to the Ministry of Health? Can I get a motion to that? Dr. Stelzer, can I get a seconder? And sorry, Mayor Logal, all those in favor? I see some hands here. Thank you. All right. Item 8 is consent items. There are 3 items. One is support for Middlesex London Health Unit's alcohol labeling policy. There are a couple of pieces of correspondence from the ministry and some quarterly reports. Does anybody want any of those items pulled for further discussion? Okay, having seen none. If there are no items pulled, I'm going to request a motion to pass all the consent items as presented in the agenda. Can I make a motion for that? Councilor LaChica, seconded by Councilor Real. All those in favor? I see some hands. Thank you. That's carried. Any new business? Anybody have any new business? Okay, not seeing any. We'll move to our in-camera session. I need a motion to proceed to in-camera to discuss one item in accordance with the Municipal Act. And the exceptions have been noted on the agenda package for that. And Mr. Maloney and Warden Clark, all those in favor? Thank you. We are moved into closed at 4:32.
Just give me a moment to stop the live stream,
Yep.
okay?
Yep.
And recording.